This is to demonstrate a head wrap scan. This is for patients who have an internal auditory implant, such as a cochlear implant or an auditory brainstem implant. There are some contraindications before performing a head wrap scan. Everyone should check the manufacturer's guidelines to see if you are able to do the MR scan for that particular implant. You also need to check for any infection at the site, check the device safety, check the scanner strength. Usually you're only able to scan on 1.5. Check that the patient has not got a meningocele. Also discuss with the patient, see what their anxiety, distress or levels of discomfort they have or may feel they have. On screen is a tray of the equipment needed to perform the head wrap scan. This includes what we use at Manchester, Ottoform hearing aid mould, plus other basics. Prior to the head wrap procedure beginning, the patient needs to have signed a consent form. The type of consent form depends on the type of device the patient has. There are 2 consent forms that we use. These are consent forms where the patient may need to have subcutaneous local anaesthetic used and also the head wrap procedure itself. Newer implants do not need a head wrap or bandage applied. This will be a separate consent form that the patient will sign. The 2 different consent forms will be available on a separate slide. The nurse undertaking the procedure will also countersign the consent form. A lot of patients with auditory brainstem implants and cochlear implants can be deaf, and it can be helpful to use an app on their smartphone to assist with communication. Prior to the head wrap scan, you need to check the patient's skin and the area around where the implant is inserted. This is to make sure that the area looks well healthy and there's no sign of infection. Also to check where the internal implant is and to check the internal magnet. You are sometimes able to feel the actual internal magnet, the rim of it, to see if it's smooth. It's easier to use the patient's external processor to check the site of the internal device. If this is not available, as not all patients will bring their external processor, it is advisable to have a selection of magnets from one of the implant centres. These are magnets which are used in the internal device or the external processor, so you are able to locate the internal magnet. Once you have the patient's consent to proceed and all information has been given about potential problems, the patient understands how to stop the scan. All of the safety checks are completed and you have all the equipment required. You need to ensure that you use ANTT during the procedure at all times. Using the appropriate skin cleaning equipment, you put the external processor on the patient's head. Then using a site marking pen, mark around the outside of the external processor. Lifting the external processor up slightly, you can then also mark in the centre where the internal magnet is. This can then be used as a guide for where you give the local anaesthetic. The equipment used is skin cleaning, site marking pen, external processor or the implant magnet, local anaesthetic. The one we use in Manchester is bupivacaine hydrochloride 0.25%. Needles and syringes, 5ml syringe or a 2.5ml syringe. Some trusts do use pre-made local anaesthetics. Earplugs, Ottoform to form a splint, a compression bandage and tape to secure the bandage. When giving the local anaesthetic, use where you've already pre-marked. Inject at a 45-degree angle. We give up to 2.5 mils of the local anaesthetic, given evenly over where the internal magnet site is. Once the local anaesthetic is given, you may need to just clean around the area as there can be some bleeding. The local anaesthetic needs 2 to 3, maybe 4 minutes for it to take effect. In the meantime, you can be making the splint up from the ottoform mould. This comprises of 2 different elements which need to be then mixed together for the mixture to harden. Once you've mixed the 2 elements of the ottoform together, you create a disc which is approximately 6 centimetres across and 1 centimetre deep. It will take a few minutes for the mixture to start to harden. In the meantime, you can use the external processor to look to see that the disc is the correct size and it will cover the device. Prior to applying the splint, you need to check with the patient that the local anaesthetic is working by checking the skin to see if they have any sensation. So once the ottoform mix is hardened and you're able to handle it, you can then apply the splint over the patient's internal device. Apply the earplugs before applying the splint, and once the splint is in place, you can then apply the compression bandage. The bandage needs to be applied fairly firmly, but making sure it remains reasonably comfortable for the patient. This usually takes 2 people to do, to ensure that the bandage is applied correctly. You can sometimes need to anchor the bandage lower down at the back of the patient's neck, and during applying the bandage, it is also helpful to have one of the spare magnets that you have to check the position of the splint, that it has remained over the internal device. You usually need to put at least 4 or 5 layers of bandage when you do apply the bandage. Once you think that the bandage is secure, you can then tape the bandage into position. You also need to make sure that the bandage is not obscuring the patient's eyes, so you may need to tape this up a little. Once you've completed applying the bandage, you need to check with the patient that the bandage feels secure. The patient is then taken to the MR scan trolley, as the patient, when they go into the MR scanner, needs to be lay flat. If the patient's scan requires contrast, you need to make sure that the patient has a cannula in situ. The patient also needs to have the contrast given before the patient goes into the scanner room. This is to ensure that if the cannula is not functioning, the patient does not need to come in and out of the scanner room. The coils also need to be applied whichever scan the patient needs prior to going into the scanner room as well. There is a set procedure for the patient to enter into the scanner room. The patient needs to be flat on the trolley. The patient needs to cross the threshold into the scanner room slowly. Patient needs to go in a straight line and then at right angles to the scanner table. This is because the torque from the scanner is at its most when you cross the threshold into the room and then at the centre of the scanner itself. This hopefully will prevent pain and discomfort the patient experiences when they are in the scanner. The patient will be given a buzzer that they can use if they experience pain and discomfort. This should be described as severe pain and discomfort, as most patients do report some pain and discomfort whilst they're in the scanner. For patients with older implants, such as a cochlear nucleus 24, once the patient's buzzed to come out, it should be carefully considered before allowing the patient to go back into the scanner. This is to reduce the incidence of the magnet becoming displaced or the magnet flipping. Ideally, we would not want to scan a patient for longer than 1 hour. If a patient requires a scan which may take longer than 1 hour, this needs to have been discussed with the appropriate ENT consultant to ensure that they are happy for that to happen. When the patient's scan is completed, the reverse needs to happen when the patient comes out of the scanner. So the patient should be coming out at right angles, slowly, a straight line, crossing the threshold of the scanner door. Remove the patient's bandage, head wrap bandage. You then need to check the patient's internal implant site. Feeling around where the internal magnet is, that it feels smooth. This is to check that the magnet has not moved, displaced or flipped. When magnets previously have been moved or flipped, you can feel a raised edge around the internal magnet site. We also ask the patient to try on their processor. This is to ensure that the external process still attaches to the internal magnet. Theoretically, you can demagnetize the internal magnet itself. Some patients report that the implant does not always work straight away after having the local anaesthetic. If it is thought that the internal magnet has become displaced, flipped or moved, then an X-ray tangential needs to be performed to view the site of the internal magnet. We advise the patients to keep checking their external processor and to use it. If after 24 to 48 hours they feel that that is not working, they would need to get back in touch with us or to their ABI or CI implant centre for this to be checked for assessment and review of the internal magnet. We also have a patient questionnaire which we ask to be completed post-scan. This is to give us some feedback for the patient's experience, the pain that they've felt, how comfortable the bandage was, and if there are any suggestions of how we can potentially make the procedure a better experience for them. You need to ensure that the correct contact details are given to the patient if any problems do arise post-scan, and also that the procedure is documented appropriately in the patient's notes. Prior to the patient going home, you need to ensure that if the patient has had contrast, that the cannula has been removed.